CBS News White House correspondent Weijia Jiang is traveling with the president and brings us the latest from Mar-a-Lago, where the president is, which is, of course, Palm Beach, Florida. So the Associated Press is reporting that the White House overruled health officials who actually wanted to recommend that elderly Americans and those with underlying conditions maybe be advised not to take commercial airlines. How's the administration responding to this report?
Well, the spokesperson for Vice President Mike Pence, who is, of course, leading the fight against coronavirus, says that this story is completely fiction and that was never a recommendation presented to the task force. But the Associated Press is reporting that the CDC wanted it to be part of the guidelines to recommend to the elderly and those with an elderly condition not to fly on commercial planes. And it is notable, Anne-Marie, that Dr. Fauci, who of course is essentially the lead doctor on all of this, because he's the nation's expert on these sorts of infectious diseases, says that if you are in fact one of those people in a vulnerable group, then you should think twice about getting on a plane. You should think twice about long trips and definitely about getting on a cruise ship. So even though this was not a formal recommendation, still there seems to be some sort of conflict between what the administration is saying and what Dr. Fauci is saying.
And that conflict continues because, Weijia, we've seen the president making comments to the press about whether or not this, with regards to the containment of the coronavirus. He made comments to the press about the cruise ship that was docked offshore, and he talked about it in the context of increasing the numbers of people who are affected by the coronavirus versus their care. We've seen conflicting statements from the vice president. How is the White House responding? I mean, it's hard for the American people to know who they can turn to for information, because information seems to come at rapid rates from different sources, and it's always different from...
Right. And when you consider, I mean, over the weekend, when you look at those Sunday talk shows, these are surrogates, and these are members of the administration that presumably the administration sent out to clear the air.
Right.
And we got all these different numbers about the number of tests that will be made available. Right. And we know the number of people who have the coronavirus isn't directly connected to the number of people we can test for.
Right.
Right, and that is a huge criticism on this administration, that you could have started testing people when you first heard about this in January or even early February. But here we are in March, and you're just now saying that, there will be millions of tests available by the end of this week. And so the numbers are confusing, and it is a problem, because as you make the point, the important point is that the way you contain this is by knowing who is infected and who should be quarantining themselves and not spreading the virus in the community. Dr. Fauci says, unfortunately, it seems like community spread is happening, and that's why this testing component makes such a difference. And on Friday, President Trump said, while he was touring the Centers for Disease Control, he said anybody who needs a test can get one. That's one thing. But then he also said anybody who wants a test can get a test. And the very next day, Secretary Alex Azar of Health and Human Services had to correct that during a briefing at the White House. And he said, actually, you have to get a note from the doctor or someone in the medical profession to administer this test and say it's recommended for you before you can get it. So it's not true that anybody who wants it can get it. But they seem to have the numbers straight, at least close to straight, because they are reporting, federal health officials are saying that 1 million tests were shipped out on Friday, and by the end of the week, 4 million more will be available. So we'll see, because it depends on what we hear state by state and how those people are being tested in each one.
So the specifics of the messaging coming out of the administration has been sort of a little haphazard, for sure. But I presume that what the president is trying to do is keep people calm, right? And so the best way to keep people calm is to show that he is not concerned at all. He has these campaign rallies all the time. There are many, many people there. He has in the past said that he was sort of a bit of a germaphobe anyways. But do you know of any changes in the way he's behaving as a result of coronavirus?
Well, he claims that he will not stop holding these campaign rallies, and he has actually said this several times over the course of the past few days because reporters continue to ask him about it since his medical professionals and members of his cabinet are saying if you are an elderly person, if you have an underlying condition, if you are vulnerable, stay away from large crowds. And the president likes to boast about how big his rallies are, thousands and thousands of people. At the same time, he says he's not worried about holding them, and neither are his supporters. Of course, he shouldn't be speaking on behalf of those people because it's unclear whether or not they would continue to go to these rallies at all, since we are seeing that even in the community, they are hesitant. Many people are hesitant to get together in crowds. But it's not only President Trump. The campaign also says that they are moving forward as normal. We heard from several senior campaign officials just yesterday who told us that. But here's what's interesting, guys, is that when you look at the campaign rally schedule, there are 0 on it. And this comes after several weeks of packed rallies, some back-to-back, state to state to state. And this is really when, they're trying to ramp things up, and so far they don't have any scheduled. So we're hearing one thing, but in practice we're seeing another. But yeah, you're right. President Trump wants to insist to the public that he's not worried. And even though the mayor of Washington, D.C. over this weekend confirmed the first case in the nation's capital, he too says he's not worried about that.
And finally, Weijia, the one thing I'll say is, about this conservative political action conference where they announced recently that somebody who attended that conference tested positive for the coronavirus. That person, that individual, reportedly interacted with Senator Ted Cruz of Texas and Representative Paul Gosar. They are now self-quarantining. The president's in his 70s. So are the other 2 Democratic rivals that are running for the nomination. So this idea of continuing as business as usual, even when you've got members in Congress deciding to quarantine themselves, is concerning.
Right, and the White House says they know who this person is and that the president and vice president did not come in contact with this patient who is now tested positive for coronavirus. But you make a really important point, which is that this person did come in contact with several members of Congress, with several of the other attendees. So the question is, if that was passed along, whether any of those people interacted with administration officials. So we're starting to see how close President Trump is to the potential of at least coming into contact with somebody who may have it. But the White House insists that they're not worried about it, that the president's doctor is doing everything that he should be to make sure that the president and the First Family and the entire White House complex remains safe and clear. What they will not say is whether he has had a test for coronavirus, and I don't think that will change because obviously they're hesitant to release details about his health unless it's a really good report about how healthy he is. And so I just don't think that they will go there. But it is a question on everyone's mind because, the president is 73 years old. He is, someone who could be considered vulnerable. And because he continues to travel in this way and because he does have potential exposure, it just seems that he would be getting tested, certainly if he has any symptoms, which we have not heard of yet.
All right, Weijia Jiang for us. Thank you, Weijia, as always. We appreciate it.
Thank you.